CNOC today, Cherokee Nation's Outpatient Health Clinic in Tahlequah, and I'm here getting my COVID-19 vaccination. I'm getting the vaccination because it's been found to be effective in the large number of patients that it's been trialed in, and the risk of side effects is very low, and I want to reduce the possibility that I could give it to other people and that I could catch it myself and have severe disease from it as well. In general, this vaccine's been tested in over 40,000 patients, and in the patients that received the vaccine, the risk of adverse events was similar to the placebo, where they were given a dose of saline instead of the vaccine. So it's a safe vaccine, as safe as other vaccines that we've tested and used. We don't have long-term safety data on it because this is a very new vaccination, and that's why we're getting it under this special program, the emergency use authorization from the FDA. But most of the time, if a patient's going to have an adverse reaction from a vaccine, it's going to happen very soon after you get it, within the first few days. And we do have good safety data within that time frame. We have safety data going out 3 months now. And we also have very good efficacy data. So this vaccine triggers the body to produce antibodies, and it produces antibodies at a rate that are typically higher than somebody that's even been infected with COVID-19. And so it appears to be very effective, and the initial patients that have been studied with this, it had a 95% effectiveness in reducing your risk of catching COVID-19, and almost 100% effectiveness in reducing severe disease due to COVID-19. So that would be hospitalizations and patients who develop very severe disease like intubation or death. One of the primary side effects is typically a little bit of soreness where you have the shot at, very similar to when you get the flu vaccine. And that's a very common side effect that many patients will get. But otherwise, it was a painless shot that very similar to the flu shot we get every single year. The initial dosing is to expose your body to those proteins so it will develop antibodies to it. And the second dose that you get 3 weeks later is to further instill that memory antibody response that your body will develop. And so it makes you have a more robust immune response to it. And after you get that second dose is where you get those real benefits on reducing the risk of spread. This is my 14th year here at Hastings Hospital, and this has really been an unprecedented disease in my career here, and I've been taking care of hospitalized patients for that entire time frame. And we've never had a disease that has caused this amount of hospitalizations and severe disease. And primarily it affects, with the severe disease, older patients, but we have seen some younger patients who have developed very severe disease and unfortunately haven't survived this disease. And it's really devastating having to go in and have that conversation with the family where 2 weeks ago their family member was with them and smiling and happy and never had any breathing problems at all, and now they're on a ventilator fighting for their life, or unfortunately some patients passing away, and you're having to have those devastating conversations and delivering the worst news that you'd ever have to deliver. So a vaccine that can prevent that, it should be taken by everyone.